Tropical diseases. Malaria. Malaria is a mosquito-borne disease presenting with fever, headache, fatigue, and hemolysis. Diagnose with a thick smear for detection, thin smear for speciation. Treatment for mild to moderate malaria. Infection with Plasmodium falciparum, mefloquine or atovaquone, proguanil. Test for G6PD before using primaquine. Non-falciparum infection. Chloroquine or Vivax and Oval only, primaquine. Manifestations of severe malaria include parasitemia greater than 5%, CNS abnormalities, confusion, seizure, coma, hypotension, shock or pulmonary edema, renal injury, acidosis, or hypoglycemia. Treat severe malaria with artemisinins, artemether, artesunate. IV quinine has less efficacy and more court prolongation toxicity. Malaria prophylaxis. Mefloquine or atovaquone. Proguanil. Avoid mefloquine with history of neuropsychiatric illness. Mosquito-transmitted viral syndromes. Chikungunya. Chikungunya is caused by a single-stranded RNA of African origin. The disease is characterized by intense joint pain that may persist for months, periarticular edema, and rash. Less than 50% of cases. Dengue. Dengue is characterized by bone pain, not joint pain, and the second episode is worse. The disease causes severe thrombocytopenia that can lead to petechiae and GI bleeding with sometimes fatal hemorrhage and shock. Look for low WBC count and high transaminases. Fluids with blood and platelet transfusion may be needed. Zika. Of the viral syndromes, Zika is the most dangerous in pregnancy because it causes microcephaly. It is also associated with Guillain-Barré. Ebola. Ebola is not transmitted by mosquito and not airborne. It is transmissible only by direct contact with body fluids from a person in whom symptoms are present. It presents as a nonspecific viral syndrome followed by severe GI distress, with high-volume diarrhea. Low WBC and thrombocytopenia and increased transaminases are common features of Ebola. Patients often develop encephalitis before succumbing to hypovolemic shock and death. Even with rehydration, mortality is 70%.